Thank you, Madam Secretary. I know a number of our Republican colleagues think they can defeat health insurance reform through anecdote, but fortunately the facts really support the testimony that you have and the reform that we have underway. While I think that Dr. Berwick did an outstanding job last week in explaining the increased cost that seniors will face if what they call repeal and what I would call the Republican Senior Insecurity Act were to be approved. It means seniors pay more out of their pockets for prescription drugs. It means seniors pay more out of their pocket for a cancer screening. It means seniors pay more out of their pocket for health insurance premium increases. It means that seniors pay more out of their pocket for copays, and all we get out of that, other than seniors having to pay more, is that the solvency of the Medicare Trust Fund declines by over a decade if they're successful with their Senior Insecurity Act. I want to touch on some of the anecdotes, though, as well, that they mentioned about Medicare as far as the availability of physicians to seniors, something that we provide incentives for, in fact, availability for all of Americans through our primary health care incentives in the new act. Isn't it correct that last year 96% of American physicians had Medicare participation agreements?
I think that is a correct number.
So there may be some anecdotes out there, but it's, according to CMS, almost all physicians in America have signed up to participate in Medicare, and I would offer for the record at this point a report prepared by our Ways and Means Democratic staff concerning Medicare beneficiaries reporting reliable access to physician services, Mr. Chairman.
Objection.
And it shows that actually, while this is an issue we need to keep working on, that seniors tend to have more access than some people do within the private health insurance system. While the focus on seniors is very important, I want to also be sure we have touched on the effect of this important health insurance reform that you're helping to implement on the rest of the population. If the Republicans were successful in satisfying the desire of the big insurance monopolies to undermine health insurance law reform, about how many young people age below 26 would lose health insurance coverage that they gain through the reform? Aren't we talking about a couple of million or so?
Yes,
that,
sir.
that will,
I think
they repeal?
2 to 3 million are the up to 26-year-olds who now can stay on their family
didn't have
policies.
it before. And
That's
so they
correct.
can call it repeal, but to a young person who is counting on that insurance, it means terminate their insurance coverage. What about the study that your department did concerning pre-existing conditions? Do you have an estimate of about how many Americans will now, if they are successful with repeal, will now see their coverage either terminated or limited as a result of a pre-existing condition if we don't have the guarantees that this new health insurance law provides?
It's close to half of our population has a pre-existing condition that by insurance companies' terminology either changes their rate or actually could lock them out of the system.
So there are millions of Americans that really have a stake in not going back to the old system of letting the insurance company decide that you're not going to get insurance or your insurance will be largely meaningless because of some pre-existing condition that they have defined. And then as it relates to our small businesses, if they are successful in undermining health insurance reform, about how much in tax subsidies will our tax incentives for providing health insurance coverage, about how much will small businesses across America lose?
Well, we have right now about 4 million small business owners who qualify for the graduated tax incentives that provide some help for them to provide employee coverage. So we'll know at this year's tax time how many actually took advantage of that, but there are 4 million potential business owners, and again, anecdotally, we know that a lot are beginning to connect with those benefits and come back into the marketplace.
Thank you very much for the important work you're doing in implementing this act. I believe we will see the original objectives of this act fulfilled with the work that you're doing.